Thanks everyone for being here. We are really lucky to be able to hear today from Harry Leslie Smith. I heard Harry, who was actually one of our members from Welland, Fiona McMurran, who's been fighting to save the Welland Hospital and who has herself got family in Britain. And she, just before Christmas last year, sent in a video of Harry speaking to the British Labour Convention, Labour Party Convention. And I watched the video and wept through his entire speech and sent it on. And I have to say, we probably received 200 or more emails back from people who watched the YouTube video. Harry has become, he's a veteran, he's 92 years old, he's become a YouTube sensation, and goes on speaking tours around the world with his powerful message about austerity and protecting our vital public services like healthcare and the gains of the last century. Please join me in a warm welcome for Harry Leslie Smith.
Thank you very much. Can you hear me all right? 92 years have passed since I was born in the barbarous year of 1923 in the coal mining community of Barnsley in Yorkshire, England. However, as the light fades on my life, I am drawn towards the narrow cobble streets of my early life that were fraught with poverty and sickness. Back then, existence was a hard-scrabble battle for many, because we lived in a primitive era when there was no public health care and good health was a privilege that only the rich could afford. That's why, in the winter of my years, I don't reflect upon my boyhood with nostalgia. It's impossible, since I learned too early in my days that life for those who can't access a doctor or medicine due to financial circumstances can be a brief and sad affair. You see, back then, my dad worked as a miner and dug coal 6 days a week for a pittance. My family, like millions of others in Britain, as well as Canada, were the working poor. In fact, 99% of you in this room today, your grandparents and great-grandparents, came from the same humble stock as me, regardless of the country they came from. Back then, we lived in deplorable slums and ramshackle working-class neighborhoods. And it was in one of those ghastly warrens that my eldest sister Marion contracted TB. And because we were poor and lived in unsanitary conditions without the ability to pay for a doctor or hospital, her disease became her death sentence. Sadly, Marion, because of my parents could no longer tend to her, my sister was taken to a workhouse infirmary where she spent her last few weeks of life alone in pain and abandoned by society. It was there on an October day, much like today, over 85 years ago, my sister died in painful circumstances at the age of 10. Tragically, during my childhood in the early 20th century, tens of thousands met their end like Marion, and millions had their lives cut short or made more painful because they couldn't afford a doctor or medicine. I can even remember as a boy hearing the piercing cries from open windows on our street from people dying from cancer who didn't have the money to buy morphine to ease their passage from life. To this day, I am haunted by the inhuman manner in which my sister's illness was treated, or how the society of my youth believed that only the well-to-do or well-connected deserved medical care. That is why, after the brutality of the Second World War, my generation, made up of ordinary people like myself, demanded in Britain that our nation create a national health care service. We knew it was our only hope of making life better for ourselves, our parents, and our children. The people of my generation sacrificed so much during the Great Depression and through the Second World War. The NHS became our peacetime dividend. The creation of the NHS was also our solemn pledge to future generations that we would be a civilized nation, that would be a country willing to treat all citizens as worthy of care and compassion. This passion for social justice, economic equality, and socialized medicine wasn't just unique to Britain. It was also a passion that burned in the hearts of many Canadians. Yet when I immigrated to Canada with my wife in November 1953 and ended up in Toronto at the age of 30, there was no public health care. It was like the dog-eat-dog world of my youth. You either had the money to buy health services or you did without. I was lucky because I was young and healthy and was able to afford the care and my growing family needed. But many weren't as fortunate as me. In the 1950s, I became friends with a fellow who had lived through horrific deprivations during the Second World War in Yugoslavia and came to Canada as a refugee. He had what was called PTSD and didn't have much luck because of the trauma he had suffered during the war. His wife ended up in hospital due to some illness. And I remember him coming to me saying that the hospital wouldn't release her until he paid the hospital bill of $50. He was desperate and asked for my help, so I lent him the money that would get his wife freed from the hospital. No civilized nation should treat patients as debtors, whose only value is their dollar value on the balance sheet of a hospital. Fortunately, Canada and the generation who had survived the Great Depression and the Second World War understood this, and by 1966, the Canadian Medical Act was established and healthcare was made free at the point of use for patients. Taking the profit out of healthcare in the 1960s freed millions of Canadians from the tyranny of sickness and poverty to move forward and lead productive lives. I know this because my family, like every other family, has been affected by some medical crisis or another over the years. Ours was affected by my wife's debilitating rheumatoid arthritis and my late son's battle with schizophrenia. Without OHIP, my family would have been destitute and ruined like my parents were by my sister's TB. We must remember that the public health care is as essential to Ontario and Canada's well-being as the armed forces are to protect us from foreign threats. We must also remember it is our doctors, nurses, and others from the staff that ensure that our health care in Ontario is one of the finest in the world. But we must also remember It is the Liberal government in Queen's Park, filled with politicians rich enough to be able to afford private health insurance, who want to take public health care sorry about that, folks. Take public health care away from the people and give it to the corporations. I can tell you, if this government has the money to subsidize giant multinational corporations and provide tax breaks for our wealthiest citizens, then it has the money to ensure that every Ontario resident has a family GP, that every resident in Ontario can access, life-saving treatments or surgery in a timely fashion. Moreover, this government has to ensure that our doctors, nurses, frontline staff, healthcare practitioners are paid a fair day's wage for a fair day's work. And this can only be done if we stop the privatization of health services in Ontario. The true profit in a public-funded, non-for-profit healthcare system is in the ability to keep our citizens healthy and productive so that they can contribute to our economy through their employment and ability to pay tax. I know we can fight this government on any future government intent on eradicating our civilized state, but it will happen because as I look out onto all your faces today, I see you have the same grit and the same resolve my generation had to build the NHS. I know you will carry on the struggle to ensure the NHS is and always will be an institution for the people and by the people. So I tell you, as an old man who has seen what Britain and Canada looked like before public health care, don't let my past be your children's future. Fight for your birthright, fight for the rights of doctors and patients, and don't let this government steal our public health care system and hand it over to the corporations, whatever you do. Thank you.
Harry, you've got some time now for some questions, do you?
Yes.
Yes. Good morning, brothers and sisters. Motilal Sarju, Unifor Local 1285, former president of the Peel Regional Labour Council. I want to say thank you so much, Harry, for bringing that message. Last year when Natalie sent that YouTube video around, I have shared that with many, many people. I'm an instructor for Unifor and I'm sharing it with every classroom I have. Because we need that public health care in this country. You know, when our health care was formed, I don't want to preach to the converted here, but it was built on 5 pillars of universality, comprehensiveness, portability, accessibility, and publicly administered. Brothers and sisters, they have taken all 4 pillars away from us, and they're into taking the 5th pillar, which is the publicly administered. And we have to fight to keep it public. Harry, I'm hoping that we can all take your message away and talk to our friends and neighbors so that we can fight to keep it. Because at your age and with what you have said there, what you have gone through, you're right, we don't want our children and grandchildren to go through. It is here for us. If they can pay the corporations, they can give them $13 billion tax breaks last year. It's time that they put some of that money back into our healthcare system so that we can have it. And I want to say something else. Only yesterday I got a call. When I left yesterday, I left about an hour early before. I want to apologize for that, but I had another appointment to go to. But a guy called me and he said, Sarge, I need to do the fight that you are fighting. I said, what is that, brother? He said, I had to fork out $500 from my pocket to send it over to the United States to help my niece because she's going through surgery and she doesn't have the money. And all the time, you know, you used to tell me about it, about our healthcare, how we should get involved, and I've never done. A light bulb came up into him, and he now wants to start a fight with us to protect our healthcare. That is only one example. But I want to say that healthcare is something that resonates with all of us, with people, with your neighbors and your friends, and if we get that message across, brothers and sisters, we can damn well get our healthcare, remain public, and let's keep it that way. Thank you very much.
We are going to have a difficult task. We're going to have to fight tooth and nail, because I know for a fact they're not going to give us that privilege of health care without a huge fight. So we have to get as many people involved in the groups that are represented here. We have to get through to the young people to let them know that their future is absolutely in danger. So get that message out. I know you're doing tremendous work, but somehow we've got to get the media involved. We've got to get them printing essays about situations that was and are coming again, unless we can change our government's mind and let them admit that human life is more important than their wealth and you know what I mean, the money seems to be the god these days. We have to decide which side of the track we're on, and I think we all know which side we're on. Believe me, I'm going to fight this battle until I drop in my tracks, and that won't be for a long time to come.
Lance Livingstone, Durham Health Coalition. I got the honor to listen to you when you came to Oshawa for the Broadbent event. I think it was in the summer or maybe early September. And you talked about how important it was to get rid of the Harper government for health care. Now that we have a Liberal government, how confident do you feel that they're going to bring the health corridor back without us trying to fight them?
I think we have to be extremely careful over the next few weeks and months. You know, we have this big deficit, 3 billion, isn't it? Something, but they don't say really that 3 billion is peanuts in a 400 billion economy, you know. So let's ignore their concerns about us being 3 billion in debt. Let's concentrate on what we have in mind, and that is health care for everyone with no cost attached.
Any other comments? Seeing none, I just want to thank Harry very much, Harry. Thank you. Thank you for coming. There you go. And I think I can honestly say for everybody here that we will keep up the fight, and we will be inspired by your words. Thank you.
I'm sure, and if anyone here needs any help from me, you know where to find me. I'm pretty prominent out there.
Yay!
Okay. Thank you, Harry.